mitigation for pregnant women does not consider the potential contribution of thyroid iodine stores. Now, we usually assess iodine intakes in people by measuring urinary iodine concentrations. Urinary iodine concentrations are a good surrogate measure of iodine intakes because in people who are in iodine balance, about 90 to 95% of iodine consumed will be ultimately excreted in the urine. Now, if we know that the iodine requirement for pregnancy is somewhere around 220 to 250 micrograms per day, what is the corresponding urinary iodine concentration? We can do this by using two assumptions. One, we have to estimate 24-hour urine volumes, of course. This is about 1 milliliter per hour per kilogram for adolescent girls, and for adult women it's about 1.5 liters per day. And we also assume a mean iodine bioavailability of 92%. This would lead to daily iodine intakes for pregnancy of 200 to 250 micrograms, extrapolated to a urinary iodine concentration of 135 to 155 micrograms per liter. If pregnancy occurs in adolescence, which is very often the case in developing countries, in a 15-year-old girl weighing about 50 kilos, a daily iodine requirement of 200 to 250 micrograms per day could translate to a UI of about 200 micrograms per liter. The problem is in pregnancy, estimation of intake from UI values may be less valid because there's increase in renal iodine clearance. And if renal iodine clearance increases in pregnancy, the daily iodine intake extrapolated from the UI would be lower than that in non-pregnancy. We're not sure if pregnancy per se significantly increases the UI concentration, but in the latest WHO expert consultation, 10 to 15% was added to the extrapolated UI to account for a probable increase in renal iodine clearance. So these are the WHO criteria from 2007 for assessing iodine nutrition in pregnant and lactating women based on the median urinary iodine concentration. And you can see that pregnant women are considered adequate if the median urinary iodine concentration is between 150 and 249 micrograms per liter. Excessive intakes are considered more than 500 micrograms per liter. In lactating women, because of course they secrete most of their extra iodine requirement in breast milk for the infant, the median UI, which indicates adequate intake, is over 100 micrograms per liter. But of course this is a population indicator and should not be used to assess individuals. Spot urinary iodine concentrations are not useful in individuals because of the variation in hydration and also in recent iodine intake. This shows you a study from Switzerland where we looked at 11 healthy volunteers over 21 days, and you can see the mean urinary iodine concentration stays fairly constant at about 120 to 140 micrograms per liter, but in an individual you get big variations in iodine excretion in the urine between 20 and 200 micrograms per day. So it's important that spot urinary iodine concentrations are not used to assess individuals, but used as a population indicator. Now, besides urinary iodine concentrations in pregnancy, we have another indicator which is recommended by WHO for assessing iodine status in late pregnancy, and that's TSH screening in newborns. Now, the newborn thyroid has a low iodine content, only about 100 micrograms, and compared to the adult, iodine turnover is much higher. And this high turnover is accelerated in areas of iodine deficiency and requires increased TSH stimulation. So you see in iodine-deficient newborns, in the first few weeks, you see a transient elevation in TSH, which is called transient hyperthyrotroponemia. Now, this can be used to assess iodine status in late pregnancy because the increase in the number of moderately elevated TSH concentrations, about over 5 units per liter whole blood, over 10 units per liter serum, is proportional to the degree of iodine deficiency during late pregnancy. And in areas of severe iodine deficiency, the frequency can be greater than 40%. Now in our national iodine studies in Switzerland, we assessed newborn TSH screening and have recently shown it's a sensitive measure of even mild iodine deficiency in late pregnancy. We had the opportunity because in the mid-1990s, Swiss pregnant women were mildly iodine deficient with a median UI of 140. In 1998, we increased the iodine content in salt nationwide